So today we'll study about anatomy of urinary bladder. So this urinary bladder is a hollow muscular organ which functions as a reservoir of urine, and it gets empty through this urethra. The bladder size and shape changes according to the content of the urine. When this bladder is empty, it is in pelvic organ and it is a tetrahedral in shape, that is, it has the forehead. But when this bladder gets filled, this bladder changes shape into the ovoid shape. So what we can see is that the external feature of the urinary bladder, we can find there's an apex, there's a base which is directed posteriorly, and then neck. The neck is this, the one that is lying downward. This is the fixed part. This is the neck of the bladder. It has three surfaces, the superior surface and the right and left inferior lateral surface. This is the right inferior lateral, this is the left inferior lateral. And it has the four border, two lateral border. This is one lateral, this is another lateral border, one anterior border from apex to the neck, anterior border, and one posterior border. So this is the posterior border. So when this bladder gets full, the shape changes into ovoid. So what happens is that this apex, it is directed upwards towards the umbilicus, and the neck is directed downwards. And it has two surfaces. One that is facing the anterior abdominal wall is the anterior surface, and one that is present posteriorly is the posterior surface. To study about the relation of this urinary bladder, we are looking at the sagittal section of the male pelvis, where you can see this is anterior portion, this is the pubic symphysis, this is the anterior abdominal wall, rectus muscle, and posteriorly when we go, this is the urinary bladder, these all are area of the intestine, and this is the sacrum, this is the vertebra. Okay, so what happened is that this bladder, the apex of the bladder is connected to the umbilicus by a median umbilical ligament, which is the this is the medial umbilical ligament. This is the fibrous remnant of fetal allantois. So if this uricus fails to obliterate after birth, then the spectrum of congenital anomalies can occur in this path of median umbilical ligament. Like there might be pattern uricus where the urine, you can see if the bladder is getting full, the urine can dribble through the umbilicus. And in this tract, if it is pattern only in the middle part, then it might be converted into urethral cyst or urethral sinuses. In this urinary bladder, you can see this is the anterior surface, this is the superior surface, and this is the posterior surface or the base of the urinary bladder. So this base of the urinary bladder, in its upper part, is separated from this rectum by a pouch known as rectovesical pouch. Okay, recto and vesicles means urinary bladder. So there is a pouch, there is a proper pouch, which is the rectovesical pouch. Whereas in the lower part, you can see there is a presence of this vas deferens, okay, right and left vas deferens, and also this seminal vesicles. In this specimen, you can see this clearly. So this is the anterior surface, superior surface, and the posterior surface base. So you can see this is a proper this is the seminal vesicles and the vas deferens medially. So this is present in the posterior part or the base of the urinary bladder. But in case of female, there is no seminal vesicles and vas deferens, so it is related to the vagina, upper part of vagina and the cervix. So this is the neck, which is the lowest and the most fixed part of this urinary bladder. So it is situated just 3 to 4 centimeters behind this pubic symphysis. And the internal urethral meatus, it starts from this neck. The superior surface of the urinary bladder, it is covered by peritoneum. You can see there is a reflection of peritoneum. In the male, it is fully covered by peritoneum till the posterior border. Whereas in case of female, this peritoneum gets reflected over the superior surface of this isthmus of the uterus and forms the vesico-uterine pouch. Okay. So this is the inferior lateral surface, right and left inferior lateral surface. They are devoid of peritoneum, and it is separated from each other by this anterior border and from the superior surface by this lateral border. And this inferior lateral surface, it is just present there is presence of retropubic fat, and there is two ligaments. One is known as the puboprostatic ligament, that is it is starting from the pubis that is the pubic bone, to the prostate, that is the puboprostatic ligament, and in case of male, whereas in the female there is no prostate, so there is a ligament known as pubovesical ligament, that is from the symphysis pubis to the vesicles, means urinary bladder. Pubovesical ligament is present. So as this bladder starts getting filling, the inferior lateral surface forms the anterior surface of the distended bladder. So this surface is non-peritoneal. So there is one clinical condition where we can do the suprapubic cystostomy. It is done at this site, that is the lower level of your anterior abdominal wall, when the normal urinary catheterization cannot be done due to some rupture or some due to hypertrophy of this prostate gland. So interior of the urinary bladder can be visualized in the live by cystoscopy or in the cadaver by this surgical opening of the urinary bladder. So you can see that inside there is irregular fold of the mucosa due to its loose attachment to the muscle coat, that is the detrusor muscle. This triangular area over the lower part of the base of bladder, the mucosa is smooth as it is firmly attached to the muscle coat, underlying muscle coat. But in this specimen, the mucosa is not smooth because it has already the smoothness has already get spoiled. But this area should be smooth one. Where you can see, this is known as the trigone of urinary bladder. It is surrounded by two urethric orifice and one urethral opening. So you can see this is the apex where there is the opening of the urethra, and in the posterior lateral part there is the opening of the ureter. So I can show you the ureter. So this is the trigone of urinary bladder where you can see urethral opening, this, whereas in the posterior lateral part there is the opening of this ureter, right ureter. This you can see the lumen of the right ureter and the lumen of the left ureter. So when the urine has to get empty, whole of the bladder wall gets contract, that is the detrusor muscle gets contract. But this area, this triangular area does not get contract because you can see the three important openings are present in this trigone of the bladder. So these two ureters are open at this posterior lateral angle of the trigone of the bladder, and this opening is 2.5 cm apart when the bladder is empty, and it is almost 5 cm apart if the bladder is getting full, and the apex there is the opening of this urethra. So there is an elevation known as the uvula vesicae in the posterior part of this urethral opening. This uvula vesicae, it represents the median lobe of the prostate. So in this male bladder there is a prostate where it has 5 lobes, and the median lobe is represented by this uvula vesicae in the interior of the bladder. In a clinical condition known as benign prostate hypertrophy, the median lobe of the prostate gets enlarged. So when the prostate median lobe gets enlarged, which is represented by this uvula vesicae, so this also gets enlarged. So the normal urine flow through this urethra gets obstructed, leading to some symptoms of bladder outlet obstruction. The more patient force the urine, the more this uvula vesicae creates the ball valve mechanism. So the person, they complain of urgency, hesitancy and frequency of the urine.